Good afternoon. Good afternoon. Welcome. Come on in. We're glad to have you as a part of our webinar today. My name is Pastor Darren Brake, lead pastor at the House of the Lord. And this webinar is a partnership between the House of the Lord Church and Summit County Community Partnerships. And it is funded with a grant by the Ohio Department of Mental Health and Addiction Services. And I want to welcome you to Hidden in Plain Sight, a opiate use disorder webinar series. It's actually an education and awareness webinar series that we've been having going back to the spring of this year. You are joining us in our fourth installment. So just to give you a little context of kind of how do we end up here, we started off dealing with the context and how really COVID has set the context for opiate use disorders, really has set the context for really how we do life nowadays. So in our first installment, we did a panel discussion. We had a very distinguished panel. We had President of Akron City Council, Margot Somerville. We had Dr. Michael Forbes from Children's Hospital, and we had Robert DeJournette, and they were giving some of the different kind of high-level impact of how the context of COVID is impacting around the opiate use disorder. In our second webinar in this series, we dealt with overcoming some of the stigmas that are associated or hinder people in their recovery process. And we spoke with Stan Frankhart, who's a program coordinator for Returning Home Ohioans and Community Transition Program. And he works with a lot of people having to deal with recovery, deal with those stigmas, especially as they're returning home from being incarcerated, which adds a whole nother level to what they're going through and trying to recover. From there, we actually went and dealt with some resources from somewhat of a local and government perspective. We had a conversation with Perry Clark, who is the founder of Truly Reaching You, which is an organization that deals with men recently returning home from incarceration. And of course, there's addiction issues and things there. But then we also had in that conversation Dr. Joan Williams, who at the time was the outreach coordinator for the 11th Congressional District. So we've had all these videos, we've had all these webinars leading up to this one today, where we're going to be hearing from Pauletta Hatchett, who represents Summa Healthcare. And what we want to look at today as a part of this webinar is that we're going to talk about how COVID has taken so much attention that there are so many things that are hidden in plain sight as it relates to opiate use disorder, hence why we've been calling this webinar series Hidden in Plain Sight, because a lot of this stuff is just that. So we want to take a little bit of time and talk about the people. We want to talk about the problem, and then we're going to also talk about a new potential solution that Summa Health Systems is bringing into the Akron community, is actually on the west side of Akron. And that's where Pauletta, who I'm very well acquainted with. I consider her a friend of mine. She is one of our own here at the House of the Lord, and we are so grateful and happy to have her on today. She is the manager of pregnancy, health, and at-risk populations at Summa Health System, which includes pregnancy, postpartum, and addiction care for women. So she is definitely able to talk to this subject. She is a certified mental health professional and instructor, advanced grief recovery specialist, and senior fitness and women's fitness specialist. Pauletta Hatchett has been faithful servant leader for 27 years at the House of the Lord Church in Akron, Ohio, under the spiritual covering and pastorate of Bishop Joey Johnson. Pauletta Hatchett is also an ordained minister and prophet and senior chaplain. She is sought after speaker and ministers locally, nationally, and internationally in 12 nations. She is the founder and director of Grace Ministries, DBA MegaFit Health, Recreation, and Fitness, and New Day, New Hope, whose mission is to encourage people to live healthy, holistic, active lives and help those who suffer from grief, mental health, and trauma issues. And on top of all of that, if that is not enough, she is a healthcare change management program at none other than Cornell University. More importantly, she has a tremendous heart for God and people, going outside the walls of the church to relieve those who are poor, hurting, afflicted, sick, imprisoned, marginalized, and have a need for comfort, healing, and restoration. So we are definitely happy to have her here. You are in for a treat, but before we move too far into the presentation, I'm going to, as I turn this over to Pauletta, I'm going to launch a poll here. It's only about 3 questions. Please go ahead and answer those 3 questions. It only take you a couple seconds. It's just a little light, high-level demographic information so that we can understand who's in the room and who we are talking to. So with that, with no further ado, I'll turn this presentation over to Pauletta Hatchett. The floor is yours.
Well, thank you so much, Pastor Darren. It is just an absolute pleasure to spend this time today with the House of the Lord, with our community, and this series, the culmination of it on Hidden in Plain Sight. And I am, this is an area that in space that I've worked in for many years in terms of serving our community. And I just want to share some of I'll say the plight of the people, some of the programs, and what I hope you hear is passion that I will be sharing out of life experience and out of work experience and out of ministry experience. So there's many people here in the audience. I've worked in the business world much of my career and in IT and health, as well as in the nonprofit and business sector. So let's just, I want to free you to just really be thinking and plug into our theme when you have multiple sessions, each one can layer on the other, but also bring new insight and new revelation and new understanding for each of us. And I think sometimes we receive information, but what we're looking for is the transformation for our community that comes out of the information. So I'm going to be giving you some questions and challenging you from time to time. I'm going to take a moment and share my screen. And let me just launch this slideshow real quick. I want to make sure you can see that okay. Oops, sorry about that. Okay, there we go. So I want us to think about the topic of, I'll put this as a challenge to you, perspectives on healthcare access. When we think of healthcare equity, that refers to access, the ability for people to have access to different types and facets of healthcare. The perspective I want to look at for being hidden in plain sight relates to not only the context of patients and neighbors, our community, and people who struggle with addictions and life circumstances. So I'm going to be looking at what I call integrated health, because we are made up of many parts, whether that's physical health, mental, emotional, spiritual, social, financial factors. Many things go into the quality of a person's health and their ability to access healthcare. When we think of the theme hidden in plain sight, I was thinking about how I want us to just envision how that theme or idiom relates to healthcare. This saying has to do with where sometimes things are or they appear to be hidden, but actually they're not, and they can be found. So in COVID, in this season over the last year and a half, many things have gone in the background, and other parts of health and our well-being have moved to the foreground. Not only that, things can be hidden in plain sight by being unnoticed. I mean, have you ever seen a large tree and then something very small planted down at the base of the tree? That small plant went unnoticed because it was overshadowed by something that appeared to be greater. And so oftentimes that is what has happened with our mental health. We have looked at things that we can see all around us in the physical. We've looked at issues that are pressing day to day and pressures and concerns. However, with the influx of a global pandemic, it's caused things that may have been obscured in the past to rise to the surface, as well as COVID has often overshadowed many other things. So I just mentioned that. And this is when this happens, there's a setting that masks or hides the presence of others. At Summa, at our Health Equity Center, located at 1493 South Hawkins Avenue in West Akron, at the corner of literally in the Hawkins Plaza, right at that corner, across from the House of the Lord Church, we have been at that location for a good 10 years, for about 10 years. Different parts open at other times. You know, there's merchants there, there's housing there, and there's Summa Health, as well as other companies in that section. But some people are not familiar with the types of ways that we can address social determinants of health, as well as dealing with addiction. So here's just a snapshot of our suite that used to be occupied by a vision company. And now there's a new vision being implemented here. And we call this our VIP care and centering programs. And, you know, one of the things with mental health and addiction is that it's an area that is often stigmatized. So what we've done is come up with a way to refer to our patients that brings them dignity, that lets them know they're important. And so VIP stands for very important person, patient, pregnancy, prenatal, postpartum programs. We could just alliterate that on and on. But they come to the VIP, and what we want is that they feel that they're very important. The types of care that that they can get when they come in are, the anchor is on pregnancy, because we're looking to get people at a younger point in childbearing years, rather than seeing them and when they're suffering with other health diseases when they're older. We do have a whole chronic disease section in our clinic at the Health Equity Center. But we're going to go, and I'm just going to share with you some of the things that go on this side of the building. Next to this suite, as you come in on the streetscape entrance, is also an outreach programs office. And I have a team that works in there as well. But the women will be able to come in and get their pregnancy health checkups, follow up with postpartum care, addiction care, recovery. And part of our emphasis is also to educate the public through education and awareness seminars. Additionally, we want to work on eliminating and preventing, doing our part to prevent infant mortality and health disparities. And I'm not sure how many of you are aware, but the 44320 zip code in Akron is one of the key areas where infant mortality rates are higher, along with some of the key zip codes of 44307, 44306. And there's a disparity in terms of the wellness and the rate of infant mortality for the babies. So we don't want people in this region to just survive. We're looking for them to thrive. The populations, this is an at-risk population department, and we serve people that would, for lack of better words, be, not considered at risk. But we're first honing in on people that have opioid addictions and other substance use. In the African American community where we sat, opioids are not as prevalent, the substance of choice. There's many people that have substance use with marijuana is one of the prime ones in the area, alcohol, methamphetamines, cocaine, you name it. So I just wanted to mention that. But one of the things we're finding is times have changed. And when at one time, we did not run into a lot of African Americans that struggle with addictions with opioids. But now we're finding people are dealing with using multiple substances. And we've run into patients that we need to serve in that capacity. So here's some of the areas that we receive our patients. Sometimes people come through ER and then they're admitted in a hospital or another location for detox. Right now, we just started this past week a virtual program into Summa County Jail, where Pastor Darren had mentioned that sometimes, this whole issue of reentry needs to occur after people are incarcerated. So for Summa County Jail, we're trying to address the issues that people need help with before they are released. And so we're spending time in virtual meetings with the inmates that are pregnant, and then putting together a game plan, putting together a life plan, putting together resources, what's lacking, what's needed, and preparing for the birth of their baby. We will be looking to do more outreach with the battered women's shelter, recovery centers. We get patients from there and from pregnancy service agencies. In our outreach office, so our two offices are right next to each other. We have teams. Some of the people I have on staff are RN. We have a medical assistant coming on within a week. We've got a team of a good number of community health workers that handle the care coordination through the pregnancy and the baby's first birthday. So the reason why this whole first birthday initiative is going on for people to, the women they have a full term, is because the babies can't get to 1 year old. Then they have a greater chance of living and thriving and being healthy. So our RN is in the VIP suite, and we have centering circles that have been going on for years. Every other week, if someone's pregnant, we have a pregnancy week and we have a parenting week, so they can brush up on parenting skills. And you hear the word centering. It's not as well known in the community, but think of it as circles or support group, a way to meet together people that have similar or in a similar situation and may have similar concerns, are looking at life in the same season and have support. And that's the purpose of it. So because we used to meet all virtually, and then we meet in person totally until COVID. We went to a virtual platform. And now we're looking at the fall for a hybrid. So the people that don't want to come in, they can still meet virtually. And then we have actually a book club that is spun out of that, the support groups. We throughout the year, last year, and we're at a pace right now that exceeds last year, we had about 500 what we call education pathways, different topics, different weekly sessions in the circles, and also things that we did individually, working with our patients as well as we call them clients too, and as well as other topics that we provided. And then the social service pathways are things that address where we're actually delivering, we're pointing people to agencies, or we have the service on our own, such as, let's say if it's transportation, food, where they're actually obtaining not just information, but getting provided with resource. And then we were involved in 18 outreach events, some of which were with the House of the Lord and some with some kind of public health. The largest event that we did last year, our teams worked in conjunction with the rest of the Summa Health Equity Center, Medical Center. Literally everybody was working the weekend of the COVID testing. And many of you know that occurred in the parking lot of the House of the Lord. We had about 40 new babies last year, and we are going to be way over that this year. So when we talk about, I want us to think of two words. Everything with our suite is about care. We want to lead with the care. And so we do care management and case management. So here's just some examples of the resources and services. And this is just a little tip of the iceberg here. But I want to mention, if you know people that are pregnant, we want you to, or people that have young babies within that first year, because if we reach them, we can reach their families. So whoever's in that household is actually reached through the program. And that can be, their grandparents, that can be their spouse or significant other. We know that when you stabilize everyone in the household, that the quality of life is better. If there's people that have chronic diseases, then we can refer them to that area. But I wanted to mention that we provide monthly diapers to the women free of charge, as well as many other things. One of the biggest needs we're trying to address right now is transportation and housing. We have a good number of clients that are homeless. And the first thing we have to do is get them in stable, safe housing or in a shelter. And then we can sometimes, you can't have food delivered if a person doesn't have a place for the food. So these are the kind of issues that we're dealing with. So one of the other areas that's newer, we last October began with 3 of our community health workers being trained in Doula Services. And we're part of DONA International in terms of getting our credentials. And we have birth doulas. We have 3 people training through that. And in the process now of getting some people set up as postpartum doulas. What's a doula? A doula is a person that supports, helps. Here's just some photographs. Women during the labor process and after, in their ability to raise their children and to have the support they need during the birth. We have a lot of single parent mothers, and sometimes people are detached. They don't have the full support system in their families. So we come alongside them. I've got someone at one of the hospitals right now that is a birth doula trainee, and she's literally there now. And this means sometimes, can be overnight or around the clock, whatever. We just stand with them and stand by them, comfort them, and do a lot of things that we learned in training to help them. So I just wanted to mention that as well. We had recently a woman who was in our addiction program, and she, the baby was delivered by the hospital staff, of course, but one of our people was there as the birth doula during that process. And how exciting it was for us to hear when that baby was born. And we've actually had 3 or 4 babies this lately with our clients that have been struggling with addictions. And for us, it's like, wow, we're just trying to get them to the point where we're doing everything we can to walk with them and support them so that the baby lives. And it's just so exciting when they bring those babies in and we see them, or our aunt is around at the hospital or something. And it's just a bit of joy. So I just wanted to mention that. One of the other areas we are ramping up for is the Hispanic population of women who are, it's a smaller population in the city. However, they do need prenatal and postnatal care. And the Nepali clients, and many of them have wanted to come to the Health Equity Center, but we've not always we haven't had the translation services. So we have a bilingual person on our team. It's in our health equity team, and we also have right now in the process of getting the Siricom technology, which does the translation in many, many languages. And so we are very excited about that. And that will be something that we're looking to start maybe with one other population, then grow to the others. It's like when you build a restaurant, people they never came to the restaurant. They didn't know about the restaurant. But once you build the restaurant, the movie Field of Dreams, if you build it, the people will come. And so part of what's gone on here since November, December timeframe, we actually got the lease for this space in December, is the building of the, remodeling and getting carpet and furniture and cabling and internet and everything you could imagine that needed to happen to get this up and running. And we've done it in a way that there's a welcoming spirit and welcoming way there. When you walk in, we want a person to feel that this is a place of refuge and care. So when we talk about VIP and focusing on, number one, the person, we want to serve in a way that breaks and reduces stigma. So to do that, we need to lead. I'm just mentioning this with first person language. We need to say, hey, the person first, then what's going on in their life. The person, some people say their number and they're this, they're a case. They're not a problem. They're a person. Instead, we're dealing with VIPs. We're looking at people that are important, they're vulnerable, they're valued. They're not to be marginalized, stigmatized, set off on the edge of society. But we want to work with them in a way that helps build their lives and helps them integrate into be functioning members of society and thriving at higher levels than where they are. So sometimes people don't have a job. We help we point them to resources, places that are employing, job fairs, et cetera. Here's an example. I just want to mention this, that, and here's a question I noticed. Are fathers given the opportunity to participate in the centering? Absolutely. We do have fathers that come. And we do have the fathers are in the delivery room, and the doula personnel or our staff are working with them and the mom. So yes, I'll tell you this, we encourage the father's participation, and we are trusting to even build relationships with, we've already kind of tapped into a few. In our centering classes, we've even had some of the organizations in the city that work with fathers and work with building families, and from that perspective and strengthening the fathers, we've had them speak to and share in the centering circles. Because again, we deal with some of our patients are in addiction recovery, and they have their in relationship with someone who themselves need assistance, that need freedom from an addiction. So we want to when you build the families, you build the community. And so we cannot overlook that. And I'm hoping that we'll be able to have some education and awareness more as we move forward. We're trying to get this part established where we can actually have some, focus groups and ways to share information. So whoever brought that up, I'm so glad you did. We've got a few pictures in there. They have the fathers in them as well, but they're not the real fathers. We have to do that to protect our patients. So when we talk about this topic of not stigma, reducing stigmas, when we talk about, here's some suggestions, because we're talking, how do we reach these populations? Because we can reach them, but we could also offend, right? We could also have them come and then they go away. So when people who use drugs, that's a topic, instead of referring to them as a junkie or a drug abuser, you could even put in the chat other names you've heard people call that are not words that build and demonstrate love and care, but bring stigma and separate and, exclude people and marginalize them, for example. But we want to reword. See, words matter. That old adage, sticks and stones may break my bones, but words will never hurt me. That is not true, because some of us as adults live with the memory or live out these negative words that have been spoken over our lives. But words do matter because they connect us to our identity. They allow us to gain the perception of how we fit in with community, how we view our self-worth. So we need to say, this is a person with a substance use disorder. This person has lived experience with marijuana, versus saying they're an addict. People who have used drugs in the past, we have people, they're not using, they're not right now struggling with a particular substance, but we don't want to, instead of saying, this is a form here, I want to introduce you to a former drug addict. No, this is a person who is in recovery. And the Ohio OMAS for the Mental Health and Addiction Services clearly teaches with the peer recovery programs that people are oftentimes they're in lifelong recovery. They're in a recovery process. And then if they're currently using drugs, we want to refer to this is a disorder. They have this is a drug dependence. So just be careful with your words. That's why I say that, especially if we're looking to reach people, right? Many methods, words, principles relate to addiction care and recovery. We want to begin with the end in mind. We want people to know, no matter where they are on the spectrum, look, even if some people are sitting on this call right now that may have struggles with food or other type of behaviors, or we know people in our family or community or workplace that do, right? So we always want to have this element of hope and that there is a possibility. So that's why the scissors are cutting off the beginning prefix M and saying, we look at the possibilities. That's the other VIP, the possibilities. And so part of what we're covering today in this webinar is re-examining. What I'm doing is bringing these things up to challenge us, to have us re-examine our thoughts, our views, our words. What's our viewpoint, our vision? A lot of people have lost their vision and they just can't see what's next. And what we do is help them re-envision until they're able to catch the vision and build their own vision. So I want to mention a few things about opioid use. I like to have one, I want to make sure with time-wise, one of the facilitators just clue me in on how we're doing time-wise. I just want to make sure I'm good. The opioid use and abuse, it's increasing all over. And from the time from May, that ended May 2020, was the largest use, or the 1-year period ending May 2020, at the heat of the pandemic, the old heat, because now we've got these variants going, was the largest use of opioids and other substances. And the US has spent over $570 million treating just the infants that are in withdrawal from this opioid use. And that was 5 years ago. The figures now are just huge. Why has the use increased? Why is it prevalent? Because the supply of drugs has increased. People can access prescription drugs very easily. Again, I started out about access, and people have access to street drugs. More people, why is it increasing? Why do people feel they need this? Because of the emotional and physical pain. Look, I'm going to use one word: brokenness. Our society, our community, people are broken. We didn't even have the grasp. Who could imagine that we'd still be in the heat of this pandemic now? Who can imagine that it would be difficult for us to embrace and see loved ones? Who can imagine how travel has been limited? Who can imagine how much money we have spent in paying for things that we never bought before, or just had, oh, that's emergency supplies. I'll need a mask. I'll leave it in my first aid kit or whatever. At the hospital, of course, we have access, but I'm just mentioning this. How much money have we spent on rubber gloves and extra things for food and things to be delivered to our homes? So more people are experiencing hopelessness, institutional and systemic problems, and I'll put it this way: collapse of society. When society is in collapse, in late stages of collapse, there's just so many things that are just released and are just prevalent in the community. And I don't believe that we have not seen all of it yet. And we need to really live in a way that we can really brace ourselves and help people. If we don't learn as a society to be civil with other people, we think things are just on the margins with certain populations. Look, if there's certain things going on in communities, this world is a broad global world, but it's there's tight and overlap communities. It will affect us. Like we heard Bishop Johnson say, we don't worry about things when it's around us, but when it's in our neighborhood, it may be coming our way or around in the borders. So we need to have a regard and value for all life and all people. Opiate use threatens, it's not just considered a health problem, but costs society billions of dollars. What could we be using with that? How could society be better if we were using that money and it was reallocated in different ways to educate people, to build infrastructure, to support people? And here's a question about the infant mortality rates. Why are they so high in 44320? And so I'm getting ready to, the question came up also about what role do opioids play in infant mortality? I have a quick video that I'm going to show you a few seconds of it. And I'm going to mention that in 44320, there is a high unemployment very high unemployment rate. When people don't have jobs, when people and housing, there's a lot of people that rent homes. They're not able to, they don't have the equity, they don't have the finances to buy homes. So when people don't have a way to pay for their rent at times, can't have a mortgage, don't have a job, they turn. What happens is it could be any one of us. Look how many people have been in unemployment or furloughed or put on a leave of absence or whatever since COVID. Look how many people were applying for unemployment. You couldn't even get anything processed on the lines because of so many people calling in and putting things on the internet. System overload. People have to have a way to cope. You know, if we didn't have coping mechanisms, and thank God that our bodies are made the way they are to handle things and find new reroutes and alternate paths of our blood system and all kinds of things and arteries and nerves and everything, or we'd be an absolute mess. At any one point in time, anybody with one event, death, loss of job, loss of become depressed and immobilized. At any one point in time, people can become vulnerable. And so there's concentrations. And the other things is, there's a lot of studies that have to do with people that live near factories, especially, in some of the inner cities toward the downtown areas. We don't have much of that in Akron, but there's so many things about the quality of air, the quality of food. If you are struggling to pay for food, tell me about your health. If you're buying foods that are loaded with carbs, sodium, etc., with low nutritional value, even if you get sick, can you fight it off? I mean, who wants to talk about these things? But I'm a truth teller. This is where the rubber meets the road. And so when people are vulnerable in that way, they become, this word that's on the screen, hopeless. When people are hopeless, they're in anguish, they will do what they need to do to get out of pain, even if it's destructive to them and others, even if it cuts relationships off with others. Okay, let's keep going. So, two main types of opioids, legal and illegal. Here's the ones, painkillers. People, a lot of it starts, people have back pain, and then they take many, of the prescription drugs. And that's why there's a big project, this deterrent project that Summit Community Partnerships heads, to get all these unused prescriptions, get them in these deterrent bags and get them disposed properly, because people are using other people's prescriptions just to get out of pain. Those are the legal ones, common names. And then there's the ones that are also, I'll say, street names. Heroin is an illegal drug that can be injected or inhaled. I've put down the different form of it. And it's street manufactured. And so it's a type of opioid that's addictive, and it affects the brain. So whether it's a prescription or whether it's heroin, whether it's Oxycontin or it's heroin, they have highly addictive properties. That's why people need to be managed in their care when they have this. And I want to mention this. This is why, here, the effects on the brain. Heroin and opiates cling to the same group of brain receptors, which can cause sudden change in a person's mood, awareness, and breathing. This is not just a physical binding, this is a chemical binding. So when something is chemically bonded,
How do you break that chemical bond? This is why it's so difficult for people to come off of these substances. The prescription can produce similar effects. And so, the person's feeling better, they have less pain, but there's a big but here. But the pleasurable feelings don't last. And so they have a need for something else, another dose, more. And it can get out of control because the body adjusts, the brain adjusts to that demand. So what we need when we're helping people are integrated health solutions. It's not going to be all the time just the medication assisted treatment. It might be that and counseling. It might be this and that. And that's why, with peer recovery support, one of the things we do is try to have people, the patient, what will help you? Where are your resources? Who do you have? Some people cling to spiritual resources. Some people are like, well, I have financial resources. I can buy my way this and that. But when finances are dried up and relationships are dried up, what do we have? So the receptors are involved in the brain to help people deal with tolerance, dependency, and addiction. And if a person keeps taking these drugs over time, their brain adjusts. That book, The Body Keeps Score, reminds me, by producing fewer of its neurotransmitters or reducing the number of receptors that can receive them. So when we think of communication, there's a sender and receiver. We're talking about the receptors are blocked, have binding, adjust. And that's why people aren't thinking. You think, why are they thinking that way? That's why. I mean, it's logical because that's how the brain works. So let's look at, I need to hustle here. The powerful effects, there's a gateway effect, there's entry points and triggers. A person can be coasting along very well for a long time, and something triggers a thought, a song, a date on the calendar. Grief is triggered that way also. And some people switch from one drug to another one that's cheaper and easier to get. So sometimes they can't get, nobody will write me a prescription, this and that. They'll find a way if they're looking something. And when that gateway effect happens, then they move into even more, it's like you cycle down a withdrawal effect. Repeated uses create dependence and continued abuse. People suffer effects when the drugs wear off, unpleasant withdrawal symptoms. Here we go. So a person comes in and now they want to break the cycle. But guess what? Now they have shivers. Now they have diarrhea. They're going to be up all night. They have sleeplessness, abdominal cramping, the whole body's aching, muscles, bones, everything. And then they start deciding, man, it's not worth this. I'm feeling terrible. They want to use again. I'm not going to go over the signs of an overdose on this session. I live this, but I just want to mention that because that's a whole, we can't do that today, but we can do that some other time. Increased risk factors when people mix drugs, if they have a lower tolerance. Some people can take a few of one thing and not be affected, and someone else may have a lower tolerance. If they have health problems, that can complicate. So we have people that come in, they have all these, they're hypertensive, they have diabetes, and they're using certain, they have certain substances that they've used, and they, have an addiction. It's hard, when their system is, the immune system is lowered like that, and they have a low tolerance for it. And here's one: genetic history and family history. When people are around, a lot of things we find are generational. This generation did it. They watched the grandparent or parent do it, or they have friends. Somebody introduced them by modeling it or providing it, or they saw it or whatever, or they've had a previous overdose. So this is why I'm bringing up the social aspect and relational aspect of addiction. It's not a straight line.
people move back and forth. I'm not putting up the algae. Some of us are mental health. I think I mentioned this one already. It was embedded somewhere else. Algae action plan for those of you who know about mental health first aid for adults or youth. And I tell you, that teaching will prepare you a lot to understand things that go on with the issues that we run into with caring for people with addiction care and recovery. I want to mention that we do have a lot of community partners, and I could fill this up with the whole board and other pages. But to do a lot of our programs, we do use, there's some that are involved with some of our centering classes, workshops. We'll be out there on the 21st at the House of the Lord with the other agencies like United Way, especially with Summit County Public Health, leading the way for the DriveThru baby shower that is coming up. And some of you have received information on that, one at the House of the Lord, them hosting it on August 20. That's last year's. They have a new one out, but this is just example of just a lot of the care and items that were given away. I want to mention that we have a local resource in the ADM board, and we have a mental health hotline that people can call. There's a text. In my suite, we have the bracelets, and we can give to patients that have the crisis helpline numbers that people can text for HOPE to 741-741. And I'm going to show you a quick video. I have that is literally all of a minute, and another one is like 30 seconds, because it will summarize a little bit that you mentioned and give us some food for thought. I'm going to stop sharing this, and I'm going to share the video if I can get to it. I hope I can here. Give me 1 second. I forgot we're recording. I'm trying to get to it. I have it in my background here. There was a question that was, if Pastor Darren, could you give me just about 30 seconds? I just need to get that up on the screen. I think I can get to it here. There was a question about the infant and what that looked like. Can you see that right now on the screen?
CDC is urging pregnant women to get vaccinated on the heels.
Oh, that's different. I'm sorry. Oh, whoa.
Getting badly sick or having pregnancy complications due to COVID, but their vaccination rates are very low.
The CDC says only about 23% of.
Okay, this is the one I wanted you to see. Can you see this one? Can you see the infant's feet?
Yes.
Okay, this is what happens when I'm going to stop this, because it's hard to even watch the suffering of the baby when this is going on. this is another one I wanted you to see how important it is.
Concerns. Mental illness is not always easy.
Would you give me a thumb up if you can see this one?
Third line, please.
DEPRESSION.
Mental illness doesn't show up on a scale. Bipolar. Sorting out a mental health concern is not something to attempt on your own.
I thought so.
Like many health conditions, help for mental illness takes professional diagnosis and treatment. And the sooner you seek treatment, the better.
Look at that. 6,000 steps in PTSD.
If your loved one has a mental health concern, don't go it alone. Find out what to do. For 24-hour free and confidential information and treatment referral, call 1-800-662-HELP. Learn more at samhsa.gov.
I wanted to mention that SAMHSA is a wonderful resource for people
/support.
That want to be able to, there are just tons of videos and resources there.
Creating community-based responses for behavioral health emergencies, homelessness, and substance use disorders.
Let me stop that, please. Okay. And I have one other that's 30 seconds. This is one that I want you to think of resources with this one. And I want to make sure that I'm sharing this appropriately. It's a very quick one like the others.
To that secret place. Spot that over. And instead of what you came for, you found this. What would you do? Would you stop and give it some thought? The truth is, all drug use comes with risk. Before those risks become real, before drugs turn your life upside down.
You want to write that number down, the 1-800 number for SAMHSA.
Know that there's help you can quit. If you or someone you love is struggling with drug use or prescription drug misuse, then you can call 1-800-662-HELP for 24-hour free and confidential information and treatment referral.
Okay. So I just wanted to end with that. Wanted to just have us think about some of the things that we talked about today. I wanted to have us think about how each one of us can have a part. What area can we cross over into to work with others, to strengthen our community, to strengthen our families, to strengthen our institutions? How can we be the ones that are the change that we want? We're the start of the change that we want to see. Hidden in plain sight. It's here. Our eyes have been opened. Now, what will we do about it?
Thank you so much, Pauletta. This is a great presentation. You guys are in for a treat. We're just about at our time, so just to let you know that all of the videos that were part of this webinar series will be on the House of the Lord's YouTube channel, and that is the official THOTL YouTube channel. You can go there and subscribe, and once you hit subscribe and click on the bell, you'll be notified when these videos go up, and then that way they can be a further resource to you. And this is actually our second time doing it, so there actually be about 8 different videos on our YouTube channel, all geared towards different aspects and different ways about the opiate use disorder. So this is a good resource for you guys. So take care and have a great weekend.